important question in the light of what we are seeing globally. We are seeing an increase of COVID-19 cases as much as by 80% in the last 4 weeks at a global level, with a particular focus of increasing cases in our Asia-Pacific region. So we are seeing a number of our neighboring countries reporting unprecedented number of cases during the last week on a daily basis, and a lot of this is driven by the Delta variant. We have been working with the government of the Philippines to delay the eventual entry of the Delta variant into the country, and many of the measures that the government implemented have helped in delaying the eventual entry of the Delta variant into the country. Many countries that have very stringent protocols also are currently facing the outbreaks of Delta variant because of the very high transmissibility that the Delta variant has. So, for example, we are seeing in the region countries like Singapore, Australia, even China experiencing outbreaks of Delta variant. And so we are continuing to work with the government to see how best we can prepare for an eventual establishment of Delta variant at community level in the Philippines also. While some measures were implemented by the government to ban the travel of people from known Delta affected countries, to extend quarantine on arrival, strict testing on arrival, all of these measures have contributed to the delay in the eventual detection of Delta in the country. But now we have it here, and we need to prepare for a scenario where Delta transmission, because of its higher transmissibility, will start replacing the other variants. When this happens, we see that many other countries had unprecedented surges of cases. Now, we want to reiterate that while we know that the increased transmissibility of Delta gives rise to cases, many of these surges that these countries are experiencing also were a result of a breakdown or non-compliance with the minimum public health standards. So it is critically important that we continue to practice the minimum public health standards at a community level to ensure that we reduce the opportunities for these chains of transmission to gather momentum. If we do that, we can manage the increased number of cases that would be linked to the Delta variant. The other actions that we need to do is we need to recognize the eventual increased number of cases because of the higher transmissibility, and we need to prepare our hospital care systems, our TTMFs, to facilitate quarantine, isolation, and management of patients. And of course, the most important thing is, because we know that if we can vaccinate our senior citizens and comorbid populations, we are going to reduce the number of severe and complicated cases. And through this, we could potentially help delay or circumvent overwhelming of the hospitals. So the measures being implemented now to increase vaccination coverage and also to strengthen the NPIs, the non-pharmaceutical interventions, the movement restrictions will all go a long way to help mitigating and dealing with the impending increase of cases driven by the Delta variant. So these are all important. I like to take this opportunity also again to highlight the importance of strategically focusing the vaccines on the elderly and the comorbid, because we have clearly seen that countries that did this, even though the increased number of cases were there, the hospital systems were able to cope. There was no overwhelming of hospitals, because oftentimes the infection in younger, healthier people does not require hospitalization or intensive care support. So the hospital systems and the healthcare workers can manage that outbreak. So this is why even in this situation where we are attempting to vaccinate as many people as possible, we still need to keep the focus on vaccinating the elderly and the comorbid populations so that when the increase in transmission happens, we are able to prevent an overwhelming of the hospital care capacities. And the last measure, I think, is uh, in preparation for this, we need to see how we can mobilize additional oxygen sources because we've seen the Delta variant has caused a significant demand in many countries, initially India, now Indonesia, Myanmar. We're seeing that hospitals are running short of oxygen supplies. So it is now time for us to prepare for this situation in anticipation as we do everything to try to reduce the numbers that will be generated and delay it and spread it out by flattening the curve. We need to also prepare for the eventuality that we will need more oxygen supplies so that we can better care for our patients. Thank you.
Dr. Rabi, what was the main reason on why the Delta variant went rampant in other countries that even before they detect it, millions got infected and died already?
That's correct, Eddie. And we need to recognize in many of these countries, particularly in the Asian sub-region, that we saw large spikes of Delta variant. There was also mass-scale gatherings of people for whatever reasons. And these created a situation and an opportunity for the Delta variant to spread very rapidly. So it's critically important that we not only wait for the government imposed ECQ, but if we individually start doing a voluntary ECQ by reducing our movements, by going out only for essential activities, uh, avoiding large-scale gatherings of get-togethers, avoiding getting together in closed, confined situations, we are going to be able to reduce the transmission because we know that these measures work. Even though we know that some of the vaccines are giving less protection against clinical infection, we also know that the vaccines are still capable of protecting people from severe disease. That's why we continue to say, let's use the vaccines to protect those people who are at high risk of severe disease. In this way, we can have an increase of transmission, but we could prevent an overwhelming of the hospital system. And if we can do that, we can bring back economic activity without a long shutdown or lockdown. So this should be our focus on how we manage both the risk posed by the Delta variant, but also look at how we minimize its economic impact in addition to minimizing its health impact.
Dr. Rabi, according to some health experts, there may be undetected cases of Delta variant in the country, and it's possible that the community transmission is already happening. Your thoughts on this?
Although we have very limited capacity for whole genome sequencing, consecutive assays of samples have indicated that there are Delta variants in many regions of the country and in many cities of NCR. So this drives us to conclude that with the limited capacity of testing that we have for whole genome sequencing, that there could potentially be a much larger footprint of the Delta variant in the country. What is important is not whether there is community transmission or not. What is important is that we take a risk-based approach in trying to minimize its potential further spread by implementing appropriate measures now. And I think what the government is doing, what the IATA is recommending, are all in the correct direction. But the transmission cannot be suppressed only by these measures. we need to emphasize again that transmission can be interrupted by each and everybody doing their own bit to contribute to reducing the transmission. So it's incumbent upon all of us to do what we can in addition to what is proposed by the government or the local government to ensure that we minimize the risk of infection, and we do everything possible to protect the most vulnerable, particularly our elderly A2 populations, by helping them to access the vaccines as early as possible.
But Dr. Rabi, comparing to other countries, what is the WHO's overall assessment on the measures implemented by the Philippine government to somehow mitigate the effects of Delta variant?
So I think because of the measures that I mentioned earlier on, the early banning of travel from countries, tightening of the entry protocols, etc., we have been able to delay the eventual arrival of Delta in the country. And now with the measures that are being planned, if we can strengthen our non-pharmaceutical interventions, if we can strengthen our minimum public health measures, what we are doing are measures that WHO has been advocating, not only for the Delta variant, but right from the beginning. And we know that these measures work and help in reduction of transmission. So we commend the activities that are being done. We are trying to see how better those can be targeted to the known areas where Delta variant is causing an increase in cases. And so if we can do that at scale, if we can do that at local levels, we will be more successful. So I think it's also incumbent upon our local chief executives and local government units to encourage their constituents to follow the minimum public health standards and to support them by ensuring that mechanisms are in place so that they don't need to congregate together, so that they can access their vaccines without having to go into crowded vaccination centers, so that we further minimize the risk of transmission.
Dr. Rabi, let me read some media questions for you. This is one from Joseph Morong of GMA News. Where should the Philippines focus its response to the increasing number of COVID cases, and will you call this a surge?
Well, there is an increasing number of cases, and we need to address that. We need to do everything possible to reduce the transmission. We know that in many situations, this increasing number of cases is probably attributable to the presence of the Delta variant, which we know is significantly more transmissible than the previous Alpha and Beta variants. So it's imperative that we focus on what needs to be done to break those chains of transmission. So that's about the minimum public health standards, it's the NPIs, but it's also about early testing, it's about early quarantining and isolation, probably facility-based quarantine, to minimize the risk to household contacts. Because what we know is that this variant can spread very quickly. And so minimum exposure could result in multiple cases. So when we know that there are cases, and we are seeing this very fast rise in number of cases, we need to do everything possible to suppress that.
Dr. Rabi, here's a follow-up question. You don't think there is community transmission of the Delta variant, and this is not a surge?
I cannot exclude the fact that there is limited community transmission in some places, because we have very limited capacity for whole genome sequencing. So it may be that there is community transmission. The question is, it's not important whether there is community transmission or whether there is not. It's not important whether there is a surge or we are in an increasing case. We need to recognize that we are facing a risk because of a higher a highly transmissible variant of the disease. We need to implement measures now. That is what is most important.
Dr. Rabi, another question from Gregorio of TV5. A professor of microbial genomics in UK warns that the current wave of COVID-19 in many countries might lead to existence of more variants that may also be extra infectious and also vaccine resistant. May we get your take on this?
So there is some truth in this observation, because when we see increased transmission, when we see uncontrolled outbreaks, the viral mass increases and there is more opportunity for the appearance of new mutations. Now, whether these mutations are more fitter, more transmissible, can cause severe disease, we don't know, because there are mutations that are milder and that are not as effective, and they are quickly replaced and removed. I could, for example, highlight the Theta variant that we detected in Central Visayas a few months ago, right? But that was replaced by more transmissible variants which came after that, the Alpha, the Beta, and now the Delta. And in a similar way, when you're in a situation where there is large-scale transmission, the likelihood of new mutations appearing is higher. So I agree with this microbiologist. And that is why it's also important that we do everything possible to suppress the levels of transmission, and we do everything possible to provide access to the vaccines to the most vulnerable, when we know that they are helpful in preventing severe disease and death. If we can do that, we believe that we will be able to delay the further emergence of new mutations that could be potentially even more transmissible or could potentially cause more severe disease. So we go back to the issue that we need to have the whole response for this, right? It's not just about access to the vaccines. It's not about just the NPIs. It's not about the minimum public health standards. We need to do everything so that we maximize our capability to suppress transmission. We reduce the likelihood of new mutations happening, and we protect the efficacy of the current interventions we have. So this is why we continue to urge that all countries do a comprehensive response, and that response needs to be across all local government units.
Dr. Rabi, thank you so much for your time. WHO representative to the Philippines, Dr. Rabi Abenya-Singhe. Stay safe, Doc.
Thank you, Rocky.
Samantala, as of 4 p.m. kahapon, umabot na po sa kabuong bilang ng 1,605,762 ang mga nagpositibo sa COVID-19 sa bansa matapos itong madagdagan ng 8,167. Ito ang ika-4 na araw na lagpas 8,000 ang naitatalang bagong kaso. 9,095 naman ang mga bagong gumaling mula sa sakit, kaya umabot na ito sa 1,515,054 total recoveries. 77 naman ang mga nasawi, kaya 28,093 na ang total deaths. Dahil sa mataas sa bilang ng mga dagdag na gumaling, bahagyang bumaba sa 3.9% o katumbas ng 62,615 ang nananatiling active cases sa bansa. Good news naman dahil base po sa pinakahuling report ng Department of Health at ng National Task Force Against COVID-19, pumalo na sa 20,863,544 ang kabuang bilang ng doses na naibakuna sa bansa. 11,747,581 dito ang para sa first dose, habang 9,115,963 naman ang fully vaccinated na laban sa COVID-19. Abot na sa 523,018 ang daily average sa vaccination sa buong bansa. Samantala, libo-libo mga TODA members at vendors mula naman sa Pasig City, Northern Samar at Lanao del Norte ang tumanggap ng tulong mula sa iba't ibang ahensya ng pamahalaan at kay Senator Bongo sa magkakahiwalay nilang aid distribution kamakailan. Panoorin po natin ito.
Sa patuloy na pag-iikot ng outreach team ni Senator Bongo para ayudahan ang mga labis na apektado ng pandemya, mga vendor, miyembro ng tricycle driver at operators, at mga umaasa sa pagsasaka at pangingisda ang tinulungan. Sa mga bayan ng Allen at San Roque sa Northern Samar, aabot sa 1,500 na mga pamilya na umaasa sa pagtitinda sa palengke at pamamasada sa tricycle ang natulungan ni Go. Mga transport worker, vendor, magsasaka at mangingisda na nasa halos 1,700 na residente sa bayan ng Baroy, Lanao del Norte ang inayudahan. Habang sa Pasig City, mahigit 300 na mga miyembro ng Tricycle Drivers and Operators Association ang hinatira ng tulong.
Masalamat yun po nga ako kahit katabang sa mo.
President, maraming salamat po kahit nandito kami sa malayo, nakakatanggap kami ng tulong na or ayuda na binibigay nyo, at kay Senator Bongo rin, nagpasalamat din ako sa malaking tulong po yung para sa amin.
Kuya Bongo, pagpatuloy nyo lang po ang inyong kabutihan at kami po ay paraging nasa likod ninyo.
Bukod sa tulong ni Go, may hiwalay ding pinansyal na ayuda mula sa DSWD. Namahagi rin ang tanggapan ni Go ng mga pagkain, grocery, vitamins, mask at face shield. May ilan ding bike, sapatos at computer tablets ang pinamigay ng tanggapan ni Go.
Mga kababayan ko, konting tiis lang po. Alam ko pong nahirapan po kayo. Kami rin po ni Pangulong Duterte ay nahirapan din po. Subalit, kayo po ang nagbibigay lakas sa amin para magtrabaho pa po at magserbisyo po para sa inyong lahat upang malampasan po natin itong krisis na ating kinakarap sa ngayon. Magbayanihan po tayo, magmalasakit po tayo sa ating kapwa.
Puntahan naman natin ang mga balitang nakalap ng Philippine Broadcasting Service. Ihatid yan ni Ria Arevalo ng PBS Radyo Pilipinas.
Maraming salamat, Usec Rocky. Para sa ating mga balita, trial run gamit ang Moderna vaccines gagawin sa ilang lalawigan at key cities sa Bicol. Mula Naga, naritong report ni Vanessa Nieva.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Magkakaroon ng trial run sa ilang mga lalawigan at key cities sa Bicol gamit ang dumating na Moderna vaccine sa rehiyon. Una rito, kabuang 7,400 doses ng Moderna vaccines ang dumating sa Legazpi City Airport at kaagad na inihatid ang nasabing mga bakuna sa cold storage facility ng DOH Bicol. Ayon kay DOH Bicol COVID-19 Vaccine Program Coordinator Dr. Rita May Angbon, ang mga bakunang ito ay nakalaan para sa trial run upang makita kung kakayanin ng sistema sa rehiyon ang handling, distribution at administration ng Moderna vaccines dahil isa aniya itong frozen vaccine. Prioridad naman na maibigay ang bakunang ito sa mga individual na kabilang sa priority groups A1, A2 at A3 sa rehiyon. Samantala, para sa alokasyon ng first at second dose ng nasabing bakuna, makakatanggap ng tig 600 doses ang mga lungsod ng Legazpi, Ligao, Tabaco, Naga at Iriga, habang mayroon ding tig 600 doses na nakalaan para sa Bicol Regional Training and Teaching Hospital at sa Bicol Medical Center. Makakatanggap naman ng tig 1,600 doses ng Moderna vaccines ang mga lalawigan ng Camarines Norte at Sorsogon. Halidigdi sa syudad ng Naga, probinsya ng Camarines Sur, Vanessa Nieva, Radyo Pilipinas.
Samantala, local Delta variant transmission na itala sa Borongan City. Mula Borongan, narito ang detalye kay Pen Pomida.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Kinumpirma ng Provincial Health Office na mayroon ng local Delta variant transmission sa Borongan City. Makaraang magpositibo ang 11 contacts ng kumpirmadong Delta variant cases sa lungsod. Ayon kay Governor Ben Ivardoni na pag-alaman sa PCOO na sa 11 naitalang COVID-19 positive, 4 nito ay first generation contacts habang ang 7 ay second generation generation contacts ng Delta variant carrier. Sinabi pa ng Provincial Health Office na ang protocol ay lahat ng active positive cases sa Borongan ay kinukonsidera na ang Delta variant. Kaugnay nito muling umapila si Verdoni sa publiko, lalo na ang mga taga-Borongan, ng iba yung pag-iingat sa pamamagitan ng mahigpit na pagsunod sa lahat ng health protocols. Tikang Didiha Syudad, Hiton Borongan, Pen Pumida, Radyo Pilipinas.
At yan po ang mga balitang nakalap ng Philippine Broadcasting Service. Mula rito sa Radyo Pilipinas, ako po si Ria Arevalo. Balik po tayo kay Usec Rocky.
Maraming salamat, Ria Arevalo ng PBS Radyo Pilipinas. Samantala, hindi lamang ang Metro Manila ang pinangangambahang mapunta sa kritikal na sitwasyon laban sa Delta variant dahil maging ang mga ospital sa Cebu City ay dinadagsa na rin ng mga COVID-19 patients. May ulat tungkol dito si John Arua.
Ikinaalarma ang pagdagsa ng mga pasyente sa labas ng ospital sa Cebu City. Nasa gilid ng daan, ang iba nasa loob ng sasakyan, nahihirapang huminga at naka-oxygen tank. Ito'y sa gitna ng patuloy na pagtaas ng kaso ng COVID-19 sa lungsod.
Sakit kayo ni nga tan-aon, no, nga niya karon diri sa Mount Tambalanan, kami gani nakakita. Luoy kayo nga nara sila sulod sa sakyanan, ang uban naa sa gawa sa ospital. Luoy kayo.
2 sa 15 ospital sa lungsod nasa critical level na o nasa 90% na ang kanilang occupancy rate. 3 ospital naman ang nasa high risk o 85% ang occupancy rate. 7 ospital ang nananatiling nasa safe level.
Ang ato lang karon nga gisuspetsahan nga kadtong Delta variant, pwede sa to nga hinungdan nga daghan ang kaso nga nakita nato sa palibot karon sa Cebu Island.
Nagkakaubusan naman ng oxygen tank sa mga butika sa lungsod sa gitna ng kasagsagan ng pagtaas ng kaso ng COVID-19.
Karon ra gid ni kusog og maayo. Kay sa una daghan ra kay mig stocks diha og dire. Karon kusog gid kaayo, wala na stocks nga mabilin.
Si Tatay Olipio bumili na agad ng oxygen tank para sa kaanak bago pa maubusan.
Problema kayo mahutdan sa unsa na ikuan dito ba? Napa may sutong usa niya dito. Mo pay gamit.
Nananawagan ang DOH-7 ng karagdagang medical personnel para tumulong sa mga ospital na nagkukulang sa mga healthcare workers.
To give our appeal to our nurses, especially those who just recently passed the board examination. Please respond at this time. We need you. This is the call of the time. We have to respond.
Itinanggi ni Cebu Governor Gwen Garcia na punuan na ang mga ospital sa lalawigan matapos nag-viral sa social media ang mga larawan ng mga pasyenteng nasa labas ng Danao Provincial Hospital. Ayon kay Garcia, mismanagement ang nangyari at iginiit niya na may sapat pang mga hospital beds ang lalawigan para sa mga COVID-19 patients.
It was really mismanaged. Daghan pa mag-space unta ang kabutangan nila inside. Kani bang human nature nga mangita kas labing sayon? Na makikita na sila, bota lang na sila. And these were actually waiting for test results.
Ang buong isla ng Cebu ay nakapagtala ng 54.3% na critical care utilization rate sa kanilang mga ICU beds, 43.7% sa hospital beds at 69.1% sa isolation beds. Mula sa PTV Cebu, John Arua, para sa Bayan.
Kaugnay po niyang kumustahin natin ang kasalukuyang lagay ng lungsod. Makakausap po natin via phone patch si Cebu City Vice Mayor Michael Rama. Magandang umaga po, Vice Mayor.
Magandang umaga din sa inyong lahat.
Opo. Sir, kalat po sa mga balita na nagkakahirapan ang pagdating sa admission ng mga ospital dyan sa Cebu City at paglilinaw po ng inyong COVID-19 response, hindi sa hospital beds kinukulang ang syudad kundi sa mga medical personnel. Totoo po ba ito? At kung totoo, paano po tinutugunan ang problemang ito?
It's really a concern. Just while I was waiting for this interview, I have done a hospital hopping. And of course, I am seeing the situation being calm now. because every hospital management had been already aware, and the usual concern they have is the medical staff. That is the usual concern. And our panawagan naman, of which we can tap 54 na panawagan all over Cebu Island. We have to work together, but we need this medical staff, make them go to the private hospital, saka the city government, with the council, will give them incentive 10,000 a month, and that this will be for 3 months. And hopefully that will, in a way, entice them and encourage them to apply.
Opo. Vice Mayor, pero may nag-viral nga po online na larawan ng mga nakaparadang sasakyan sa labong saan na may nakatabi at nakakabit na oxygen tank sa mga pasyenteng sakay nito. So masasabi po ba natin na talagang critical na ang healthcare system ng Cebu City?
Hindi ba masasabing hindi? Because talagang concern, but Senator Bigfoot doon sa Red Cross, they'll be sending hospital tent. Pangalawa po, ginawa rin namin yung hospital namin na mag-add ng 3 floors. Na-transfer namin yung temporary hospital patient sa 1 building doon. Gawa namin new home for COVID patient. Plus, we are also expanding and doing a redirection ng existing facility namin that from a certain 100, we will be having it to accommodate 300 more patient po. Within the city of Cebu, government, public, we probably will have medical availability. Pero we would like to also bring panawagan pa rin. Panawagan na please, the show of the time is volunteerism. The heart is needed. Let's all come out and have the medical requirement stop, and then city government will be around. Ako yung acting mayor ngayon. I'm the acting mayor po. Kasi yung mayor ko is medically.
Opo. Sir, isa rin po sa pinoproblema ng inyong syudad itong mabilis ang pagkaubos ng oxygen tanks. Ano po ang ginagawa ng lokal na pamahalaan na sapat po ang supply ng oxygen lalo na para sa mga medical facilities at hindi po maabuso ang bentahan nito?
Number one, ito na, the national government should direct DTI. And then I'm also telling the police, the marching order, assist DTI to avoid hoarding. And anyone violating, then we will have the aid of the law to fall upon their heads. And then at the same time, ito yung sinasabi ng one of the owner of the hospitals, wag naman lahat ay pabili ng oxygen. Kasi kung pabili ng oxygen, hindi man nakukonsume, wala ng tangke. Hindi naman po pwedeng diretso sa bulk. Hindi naman po pwedeng malaking tangke, ilalagay yung nandun yung mga pasyente. Kasi yung tangke, kung gumagawa ng oxygen, kailangan ilagay yung sa tangke. Kaya importante, the circulation ng tangke has to be as quick as possible. Kaya panawagan, huwag naman mag-hoard yung mga private. Kasi ang kailangan ng isang pasyente, hindi naman right away the whole oxygen. Nakukuha mo?
Opo.
Saka yung nag-hoard, nagbibinta ng malaki, they will have to be arrested.
Opo. Vice Mayor, basahin ko lang po itong tanong ni Vic Tahod ng DCAR 1026 Sunshine. Opo, Radio. Ano daw po ang nakikitang solusyon ngayon ng LGU para daw po mabawasan ang aktibong kaso ng COVID-19 sa syudad?
TTMF, yung temporary, yung treatment medical facility. Pangalawa, volunteers come forward, offer yourself to be available as medical staff. Apat, yung mga sinasabing mga orders, huwag kayong gagawa niyan kasi papadakip ko sila. Ang lima po, yung sinasabi ko, parental supervised household lockdown. Papasalamat ako ni Secretary Roque na hina-highlight niya yan. Kasi pag ang tao nandun sa bahay, walang ginagawa, stay at home, don't get out, don't be a subject of transmission, don't be the one transmitting, then we will be able to have all this COVID challenge natin being maintained and being managed po.
Opo. Vice Mayor, kami po ay nagpapasalamat sa inyong pagpapaula sa amin. Cebu City Acting Mayor, Vice Mayor Michael Rama, nawa po ay talagang makarao sa inyong lugar sa panibagong laban kontra COVID-19. Mabuhay po kayo at stay safe po.
Sige po, dasal at saka tulong-tulungan, baranggayan, bayanihan, voluntarismo at saka in God we trust. We will conquer COVID-19.
Salamat.
Maraming salamat po.
Salamat po. At dito na po nagtatapos ang ating programa sa araw na ito. Sa ngalan po ni Secretary Martin Andanar, ako pong muli si Usec Ignacio mula sa PCOO at ito ang public briefing hashtag Laging Handa PH.
Ay kaya natin to. Kaya natin to.